right, now we're official. All right, well, thank you guys for coming out tonight. I'm going to go ahead and get started here. So hopefully the lids don't get too heavy on you here. We're gonna talk about gut health. We're gonna specifically kind of focus in a little bit more on digestion, the breakdown here. So that was an intentional pun. So let's get started here. So consider this an apple, right? Here's a toddler. She's chomping down on this apple. The uh, the apple, we think like, I'm hungry. We go grab it out of the refrigerator, you know, grab a bite, and then we hopefully wash it first if it's organic. If it's not organic, definitely wash it. But now we're tasting it. We bite into it, sink our teeth into it. We start to taste it. We can feel it in our gums and our tongue, inside the mouth, the cheeks. And then we continue chewing it, breaking it down a little bit more and more. And now, we swallow it, make it into a little soft ball, a mushy ball, and then swallow it. Continuing that process, we're done with the core. We toss that in the compost, hopefully. We don't really give it much further thought. So we've kind of done our part in choosing something and consuming it. And now our body takes over. And we don't really have to think about it at that point. So interesting fact, though, we actually start the digestive process before we even grab a hold of that apple. Just the thought of it before you even pick it up starts the digestive process in your body. Your nervous system begins to make changes and fluctuations with the digestive support system just by the thought of food. And many of us have experienced that before. We'll get into that a little bit more. But looking here, this is a microscopic list of some of the ingredients, the phytonutrients that we find in just an apple, a simple apple. There's estimated to be over 10,000 phytonutrients in an apple. So
Wow.
now here we'll get the big picture of the gut here. So we've got the mouth, you know, connecting the stomach and the mouth together is the esophagus. Beyond the stomach, we've got some accessory organs here, the pancreas, liver, and gallbladder. But continuing on the track, we've got the small intestine, and then that syncs up with the large intestine, and then we know what happens after that. That's essentially the path that our food will follow. What we decide to consume is going to follow. So that's the big picture. There are four pinch points, roughly four pinch points here throughout the GI tract, where food slows down and regulating the flow and movement of the food that we're eating. The first here is the esophageal sphincter at the base of the esophagus. And then this part here, the pylorus of the stomach, there's a pyloric sphincter here on the other end of the stomach. So, that's keeping the contents of the stomach kind of contained. Then the ileocecal valve, so the end of the small intestine, after that long trip and journey down here, we've got an ileocecal valve. The end of the small intestine is called the ileum, and then this is the beginning of the large intestine here in the cecum. So that's going to continue now to one final point at the end of the large intestine called the anus. So there's an anal sphincter. So that gives us the four pinch points, kind of big picture, regulating movement and flow throughout the GI tract. So we'll start back at the top, beginning, the digestion of food. We're going to be, like we said, with that apple, grabbing hold of some food. Mechanically, we're going to break it down with our teeth using saliva as well, adding to some chemical breakdown. That's going to be secreted from specialized glands around the mouth and the jaw. So there's a parotid gland in on your cheeks, just below your ears here and in
Mm.
front of your ears. Those are pretty big glands, and they have a duct that drops saliva into the mouth and the oral cavity. Underneath the jaw, the submandibular salivary gland, as well as a sublingual salivary gland. So there's plenty of saliva that's produced by these glands in order to basically start that digestive process, take the food that we're eating and add moisture to it and turn it into what's called a bolus of food. And there are actually some enzymes in the saliva that start that breakdown and digestion of carbohydrates, specifically. So the tongue is going to push that back now into the back of the throat, and now we're going to be able to swallow, begin that process of swallowing as it's pushed down into the esophagus. So the salivary function, as I mentioned, is actually involuntary. Salivation is the technical term for it, but that is an involuntary function, something we don't have to think about. That happens naturally. Like I said, the thought of eating some food, you smell some food, your nervous system is stimulated and starts to secrete from the salivary glands a little bit, just by some of those other sensory organs being affected. And so then if we look at the impact of stress, that has an impact on our autonomic nervous system, the involuntary part of our nervous system. When we're feeling stressed or anxious, nervous, that's going to stimulate this fight or flight response, the sympathetic nervous system, which kind of turns off the salivary process. The salivary glands kind of get quieted down. Whereas when we're smelling food, we're thinking about food, we're eating food, that's going to stimulate parasympathetic nervous system, which is our rest and digest. That'll increase salivary secretions. And so you can see we can have an impact there on the nervous system, through this salivary process. Now, mastication is the technical medical term for chewing, chewing food. Essentially, you're going to do that with your teeth. The average adult has about 32 teeth. We're using those teeth to crush and grind and shred and tear apart the food, compress it into smaller pieces, actually combining that with the action of the tongue too, pushing it into the side of the cheek or into the teeth in the appropriate place. You're going to add to that mechanical digestion of food. But notice this is also voluntary. We're deciding that I'm going to chew this up so much and I'm going to swallow it. One of the ways you can improve your digestion is to make sure you chew your food thoroughly. Chew it up completely. Make sure that you're not, partially chewing food, just inhaling it, so to speak, and then swallowing it really quickly. That's going to make for more stress and congestion in those pinch points down the line that we talked about. Now, some other conditions that some of you may have experienced from clenching teeth and grinding teeth regularly. Sometimes during the day when we're under stress, feeling anxious or nervous, sometimes while we're sleeping, we might be clenching and grinding our teeth. That can cause some TMJ dysfunction, the temporomandibular joint. So going back here, that you kind of can't really see that joint, but it's tucked behind this muscle here. The TMJ is the temporomandibular joint. And that can cause headaches, that can cause some muscle dysfunction or clicking and popping, grinding, locking of the jaw. So that's, a pretty rough situation to be in, something that, requires some specific attention to get to the root cause of it. But TMJ dysfunction can be, an offspring of some poor habits with eating and chewing. It can also impact your digestion and your gut health overall. So dental health and your dental hygiene can have a significant impact on your gut health. So moving along, we see that bolus that was formed here. Again, voluntary. The tongue is going to push it to the back of the throat. That soft ball of food is now going to get pushed down into the esophagus by various muscles in the back of your throat and the pharynx. Now, this is an involuntary process that's propagated by nerves that are coming out of your brainstem and telling these soft tissues to squeeze and contract. There are fibers that run vertically up and down along this tube, this muscular tube, and there are circular fibers that go in rings around it as well. So those are going to coordinate the contraction and what's called peristalsis, the movement down through this tube, so that the contents can get into the stomach. But they have to pass through, again, that pinch point, the esophageal sphincter, that's going to have to relax in order to allow food to get into the stomach. But then we don't want it to stay relaxed because then we can lead to, that can lead to issues like gastroesophageal reflux disease, GERD. Many of you have heard of that or dealing with that. So that's a mechanical issue that can lead to chemical stress and irritation when that sphincter doesn't remain closed when it's supposed to. Sometimes it's treated by the symptoms, like, oh, I feel like acidic, so let's take an antacid, or let's take a basic like Tums or something like that to try to neutralize the acid, or maybe like a proton pump inhibitor. Sometimes that isn't the best choice because our body may have the opposite of the intended effect. Whereas if we drop the acidity in our stomach, we can't digest food well, so our brain then gets signals then back from the stomach and from the small intestine telling us or our stomach to increase the secretion of acid or hydrochloric acid. So sometimes you can have the opposite effect of what your desired effect is by trying to reduce the acid level in the stomach. Sometimes it's a bigger problem that's happening with maybe I'm not chewing my food well enough, or there are issues further down in the GI tract that are causing like a backup or a slowdown, and that's impacting motility throughout the gut. So now let's go to the stomach. This is a temporary holding place. It's just a sac of muscular tissue that's going to churn the food. It's also secreting strong acid, hydrochloric acid, HCl, that is going to help with the breakdown of food further, specifically proteins. Some enzymes are activated by this acid, which helps to break down the proteins, especially in the stomach. That's where most protein digestion begins. The carbohydrates and sugars start their digestion in the mouth with the saliva. But there are phases and different types of secretions that are stimulated through, I think, the smell, taste, sight, or even thinking about food, like we were talking about, that can cause the gastric secretions to be triggered and increase. Food entering the stomach is another physical stimulation, mechanical stimulation that causes stretch receptors to send signals to the brain and then send signals back down through the nervous system to increase the secretions of these digestive enzymes and acids. And then also, when there's partially digested food that's entering in the duodenum, that also triggers a change in the secretions here in the stomach. So now there is a barrier that's formed by mucus. It's called a mucus membrane or mucus barrier. That's going to help protect the muscle tissue this stomach is made of, these layers. We don't want the acids to start eroding and breaking down the stomach wall. Most of you have heard of gastric ulcers. Those are a result of that mucus membrane. The cells that produce that mucus are not doing their job, so now that allows for erosions to start to happen in the stomach. And so that's pretty awful. I've never experienced it myself, but I've had some friends that have, and I'm sure some of you know that people that have had or have had it, experienced it yourself. But again, gut health, so many impacts. If your gut is not healthy, it can have so many impacts on your overall health and other systems in the body. So let's talk some about the accessory digestive organs that are here: the liver, the gallbladder. The liver is really the largest gland in the body, but it also serves to support digestive functions. So its effort there primarily is the production of bile. So specialized cells will produce and secrete this substance called bile that is specifically made to help break down fats. So a good analogy here is consider like Dawn dish soap, or your strong dish soap, and you see that you squirt that into a greasy pot or pan. Now you're going to see some of the grease start to disperse and spread out. Add a little water, get some suds going, and now miraculously all this grease tends to break up and disappear. So that Dawn dish soap is an emulsifier of fats, and so that's essentially what this bile is. It's a combination of salts and some phospholipids that help to break down this substance that's coming from the stomach now and starting to empty into the small intestine. This chyme is what it's called, chyme. This is a medical term for the sludge and the liquid that's formed in the stomach from the churning and grinding and the beginning of the digestive process, with some of the acids that are in it as well. That's going to move now down into the first part of the small intestine that we're seeing here called the duodenum. Now, the gallbladder is just a temporary storage site as well, where we're going to concentrate bile. In addition to storing it, it's going to be concentrated there. And when stimulated, it'll contract and actually push the bile out into the small intestine. So that's going to, again, help with the fat metabolism, breaking down the fats that we're consuming. Now, some of you may have experienced a surgery where the gallbladder is removed. Technically, that's called a cholecystectomy. Um, this has a huge impact on digestion. If you can imagine, we have quick access to breaking down fats. Now, fats don't mix well with water, right? So you can imagine, dumping some oil inside of a glass of water, it just floats at the top. So if we try to mix those together in our gut, if they're not broken down into small enough pieces, we're never gonna be able to absorb those nutrients from the fat into our bloodstream and then be utilized by our cells. So when you lose this storage organ here, it can be a big hang up and gut problems that happen down the road, as well. So some of the risk factors for having a gallbladder attack or infection like this. If you're over 40, female, I forgot to put that one in here. If you're female, if you're over 40, childbearing age, and then also overweight if you're fat. So it was an easy way to remember the four F's: 40, female, fertile, and fat. But the fat tissue essentially doesn't mean guys won't have this. Obviously, this happens with guys too, but you're just at a higher risk if you've got some of these factors for having gallbladder issues. Now, the pancreas, last but not least here, pancreas serves two functions, with one with digestion, which is this exocrine function for essentially outside the body. Well, endocrine functions are hormone functions that most of us have heard of diabetes. Diabetes is an issue with regulating blood sugar, and the endocrine function of the pancreas is to help regulate blood sugar. So we won't get into the great depth of that tonight. We're more interested in the food that we eat, processing it before it gets into the blood. So the pancreas is going to secrete a combination of sodium bicarbonate, which most of us know as baking soda. That is naturally made by the pancreas and then secreted into the small intestine to help neutralize those gastric acids that are produced. Now, if we continue, there's also salts that are produced by the pancreas and some digestive enzymes. This is a big portion of digestive enzymes. So lipase are an enzyme that digest lipids and break down fats into lipids. Amylase is a type of carbohydrate digestive enzyme. And then the protease breaks down proteins down into amino acids so that can be absorbed. So some conditions with the pancreas: you probably heard of pancreatitis. God forbid you ever hear about pancreatic cancer. That's usually something that comes up without much of any warning. But pancreatitis can be incredibly debilitating, kind of like the cholecystitis as well. So that's kind of an overview of those contributions. So again, these digestive enzymes are secreted through a duct that empties into this part of the small intestine, along with the bile here. So they're both secreted together when stimulated and triggered. So now the small intestine. All right, so we're continuing down. Now the small intestine don't let the name deceive you. It is about an inch in diameter. It's named the small intestine because of its caliber and diameter, not because it's small by any means. It actually can be stretched out to about 10 feet in the average human. And then if we lay that out and look at the inside, the surface area that we use most of our digestion and most of the absorption of nutrients is going to occur here in the small intestine. So if we stretch the stomach out, or the small intestine out, and open it up and lay out the surface area, we're going to be about 200 square meters here. So that's huge. If you think about the surface area of your skin, if you just take a look at your arms and your legs and consider how much skin you have, multiply that by 100, that's about where
Huh.
we are with the surface area that's inside of the gut. And
Wow.
that's just mind blowing to me.
Yeah.
So continuing along our journey here, this the small intestine now has the chyme, which was the gastric contents emptying into it, and that's being pushed into the first part of the small intestine, the duodenum. We're still going to have some chemical, obviously more so chemical digestion occurring now. There's a lesser degree, some mechanical digestion that's occurring in the small intestine, but as it squeezes and contracts, just like kind of similar to the esophagus, there are fibers that run along the tube, along the direction that the tube is moving food, and then there are fibers that make rings around it as well. So as they contract in specific ways, that helps to move the contents down along the small intestine. So those, like I mentioned, the bile, the pancreatic juices are going to be mixing now here inside of this cavity, and the digestive process continues as we're breaking these foods down into smaller components. Ultimately, we look at carbohydrates are going to be broken down into various uh, levels of glucose and fructose, and those are sugars, smaller sugars. And then the proteins that we eat are going to be broken down into amino acids, which are the building blocks of proteins. And so those can be absorbed through these tiny little channels that we see here. And then when we look at fats, like they're going to be broken down into lipids of various shapes and sizes so that they can also be pulled into the bloodstream and then used by other cells in the body. So, but looking just a little closer, I don't want to spend too much time on this, but I think this is pretty fascinating. If you take a chunk of the wall out here, this is what we're looking at, these folds, these hills and valleys, so to speak.
Okay.
And now take this little chunk cross section and pull it out here, and we're looking at the surface. This surface is actually right here on the right side, but these bumps that we're seeing here, they're called microvilli. And so that's surface area that we can see right here under an electron microscope, um, where you're going to be absorbing those tiny little particles of glucose, fructose, the sugars, the lipids, as well as the amino acids. They get pulled in through channels, little gaps that are in the wall of these microvilli. So that's where that happens. So that's why you can imagine the surface area that's here. That's why we have 200 square meters of surface area in the small intestine, in the lining of the small intestine. Now, again,
Mm.
as I mentioned earlier, the involuntary part of our nervous system, we're not thinking about any of this. This is all happening automatically. Um, and so there's two major contributions to the gut movement, function, digestion. The vagus nerve, which is a huge vagus or huge cranial nerve that comes out in the neck at the base of the skull, goes down in the neck and feeds the esophagus, the heart, the lungs, the stomach, the upper part of the GI tract, and influences the activity of digestion and absorption. So that's increasing the activity of digestion and absorption, whereas the splanchnic nerve, which is a branch off of the sympathetic part of your nervous system, it runs along the middle back, like between your shoulder blades, right next to the spine. It gives off branches, and that's going to decrease absorption, decrease the digestive process. So remember, those two oppose each other. The parasympathetic is rest, digest, while the sympathetic is more of the fight or flight response, the stress reaction.
Mm.
So finally, there's a vein that is underneath the liver, a good couple spots. There's a huge vein then that gathers blood from the small intestines here, and that vein goes back up into the liver, and then there'll be a major vein that comes out of the liver that goes back up to the heart. So
Wow.
that's called the hepatic portal vein. That's carrying all this nutrient-rich blood back to the liver for processing, for filtration, absorbing, into those liver cells, which are huge powerhouses, and then various enzymatic activities occur there. Metabolism and breakdown of medications and drugs and herbs and things like that all occurs inside the liver. Now, last stop, but not least, here is our large intestine. So that's broken into several different, you can see the diagram here, it's broken into several different parts, but ultimately this tube's about 2 to 3 inches diameter, starts with that ileocecal valve we were talking about, one of the pinch points, and it's the last place where we're going to get some absorption of nutrients. Majority of it, again, happens in the small intestine, but we'll also be producing enzymes, or sorry, enzymes and vitamins with the support of the microorganisms that live in here and inhabit us. We're outnumbered by far. The number of cells we have in our body doesn't pale in comparison to the number of organisms that live in our body. So in the large intestine, it's estimated we have about 700 different species of bacteria, and they're
Mm.
considered friendly bacteria. But if we were to count them, it's estimated they're in the trillions as far as how many
Um,
bacteria actually live in the large intestine. Now, so long
mm,
as they're contained in the large intestine, we're good. If they get into other parts of the body, the stomach, the small intestine, not so good. Or, in our skin or whatnot, in a cut, a wound, a muscle, that leads to infection. So, but they're in the large intestine. That's a happy place for them to be. So if we have, some health issues surrounding the large intestine, usually we'll see one of these two symptoms, constipation or diarrhea. So water reabsorption occurs here. So imagine that substance that's secreted from the stomach, that chyme gets pushed all the way through here. So much of the nutrients have been absorbed. There's still some water there. That's going to become less and less watery as we move through here. The body's going to reabsorb that water as it needs it. So if you're not drinking enough water, well, the large intestine is going to make up for that. That means the contents of the large intestine is going to get more dry if you're not hydrated well. So when that dries up, then things move a lot slower through here. So it's really important. One of the first things I mention to my patients when it comes to being constipated is, I'll ask how much water are you drinking? Are you keeping up with that? And most of the time the answer is like, yeah, I could be doing better. How much coffee are you drinking? Or other things. So water is critical for movement through this last stage of digestion in the large intestine. So now let's move on a little bit. Oh, interesting point though. I think I mentioned these vitamins that are produced, biotin, B5, which is also called pantothenic acid, and vitamin K. They're all synthesized and processed actually here in the large intestine with the support of our little friendly bacteria. So now we all know what diarrhea is. This is a gut health seminar, so it's okay that we talk about it. But that is a situation where your body wants to get rid of something. Something's bad in here. There's some bad bacteria, some bad food maybe was eaten that's spoiled that essentially has something growing on it that's bad. And your body recognizes that. So the immune system starts to go after it and it draws water to the area. Water gets dumped and pulled from your body into the large intestine. And now we know what happens after that. But that's the process of our body trying to clear out something that doesn't belong there as well. So.
mm,
All right, so some of us we just talked about this constipation, diarrhea. These are some of the signs of dysfunction in the gut, and many of us have experienced these in varying degrees. But weight fluctuations, pain in the abdomen. Sometimes pain will show up actually in the back, upper back, and the shoulder blade area when we're dealing with the liver or the gallbladder. On the right side, you can have right upper back and shoulder blade pain that can stem from gallbladder or liver issues. So the pain doesn't always have to be where the problem is. A lot of times with the organs in our body, it can refer to other parts and other areas of the body too. So, but reflux, we talked about appetite changes, gas that's maybe excessive or maybe smells awful. It could be belching, burping as well, feeling bloated after eating. So these are all signs that your body's giving you that things aren't, happening as they should be down here. Again, our only responsibility is to put it in, chew it up so we don't choke on it, and then swallow it. So if you do a better job at that, that's your best contribution, at least to start picking good foods and good choices for drinking and eating food, but then chewing it up, making sure it's really mushy before you swallow it. Try not to eat in a hurry. That's not a good start for digestion. And then we're seeing, here some complications of obesity and some of the diseases and some of the disorders that we just touched on, associated with gut issues. Like these are all things that can stir up, flare up, and be caused by gut problems. So here, what can we do about it? Now you got the anatomy. Hopefully, you guys are still awake. Um, And now I've got, some information about what's normal in functioning in regards to the function of the gut and how we process food and things that we're consuming. But here's kind of this isn't an exclusive list, of course. There's plenty of other ways that we can add and things that we could add to this, but I figure seven's a good complete number, and we could start here. But I did notice what I did intentionally put at the top of the list. Drink more water. Eat the right kinds of food. Also, those containing fiber can be really helpful. You know, too much of a good thing isn't always a good thing. So, they're
Mm.
staying active is another thing. Exercise, that sometimes just sounds like uncomfortable to people, exercise, but we'll talk more about that, each of these points here in some more detail. Reducing inflammation in the body, maintaining a healthy weight, and then supplementing. Sometimes you're supplementing with whole foods, as well as probiotics. So let's talk about water first. So our body's made up of about 50 to 60% water. Every cell in the body uses water, and if we don't have enough of it, we're getting in the way of our cells doing their work. We're either slowing it down or completely impairing the function of the cell. So critical that we have enough water. Um, Different tissues are actually made up of different densities and compositions of water, which kind of makes sense. You think about like a muscle versus a bone. When you're looking at muscle tissue, there's going to be a lot of water in our muscle tissue, in our kidneys, in our heart, our brain tissue. The skin actually has water in it, but sometimes it feels dry and it looks dry. We know that the hydration level there is changed. So, water is a critical nutrient for our cells, for our tissues, and even looking at body composition. If we have a higher percentage of fat in the body, then we're going to have naturally a lower percentage of water because remember that they don't mix well together. So,
Mm.
so how much water? How much should we drink? Everybody growing up usually hear, drink your 8-ounce glasses of water. I like to keep it kind of simple. Half your weight in ounces is a good place to start. So let's say you weigh 150 pounds, 75 ounces of water is a good place to start. Um,
Mhm.
if your urine is clear, that's another good indicator as well. So pee in the clear. So if you're urinating frequently, that's usually a good sign that you're drinking enough water, or it could be a sign of some underlying problems with how you're processing food and digesting sugars. But if you're drinking a lot of water and peeing a lot, that's good, and it should be clear. That's another good indicator. Additionally, you can eat more watery foods. So let's get some of the fiber, let's get some of the trace minerals and nutrients from foods. But some people are just like, oh, I hate the taste of water. I'll add something to it that tastes a little bit better, a little different. Cucumbers, mint, that type of thing, watermelon. But these are some things that you can add to your normal diet to help add some water just because you're eating those vegetables or those fruits or even drinking broth or having soups and so on. So water is my number one for tonight. Now, eating more fiber, that can be done through supplements. It's always best to go to food first. So, eating foods that are rich in fiber, bananas, kiwi, sweet potato, spinach, again, they're not an exclusive list, all inclusive, but it's giving you a place to start. Quinoa, oats, and rice are some grains that have some good fiber in them as well.
Kiwi.
Is that a question?
Mm-mm.
Okay. So anyways, the fiber is going to help give some bulk to the stool, give the bacteria something to cling on and hang on to and to eat actually. Some types of fiber are consumed by bacteria in the large intestine. Pair that with some lean proteins, make sure that you're hydrating well. Again, too much fiber and not enough water is going to slow things down in the large intestine, kind of having the opposite effect that you're desiring. So again, back to that water, even drinking water is still hanging on here with point number two, eating more fiber. So now remaining active. So this one is pretty common. Really, all the systems in the body are going to benefit from increased activity or regular activity. It doesn't have to be specific, a specific trip to the gym 5 days a week. That doesn't do it for everybody. Although you'd benefit from it physically, most of us, you got to find something that you actually want to do. So, comparing that to like, I have to exercise, I have to go to the gym, saying that versus I get to go play pickleball or I get to go do martial arts with friends, your what you're thinking and what you're saying when you're approaching activity may impact how often you actually get into it. So, finding a place like, the senior center, where they've got classes going on and you've got specific times you have to show up and be accountable to, or you invite a friend so you can both hold each other accountable, or going for walks with a friend or spouse, or a four-legged creature. Um, yeah, so lots of options to stay active. You're gonna see the benefits from really all the systems in the body. Remember the stress relief. Uh, we were talking about stress and how that impacts your gut. So exercise, has been shown many times over to improve mental health and reduce stress. There's no shortage of that in our society today. So if you're looking at trying to reduce stress, in order to improve gut health, well, this is another avenue where you're going to see lots of benefits to all the systems in the body, really. And you're going to tend to sleep better too. So better sleep and better rest is going to help with that process of digesting as well. So, so find several activities that you enjoy doing, and let's get you using this phrase, "I get to," as opposed to "I have to." There's a natural resistance to that, feeling obligated to do something. So reducing inflammation. So this can be done, many ways. I don't mean just take ibuprofen. That's definitely not what I'm saying to reduce inflammation. We're talking about what we're putting into the gut and how we can use anti-inflammatory foods to help reduce the inflammatory state inside the body, especially inside the gut. So one of the ways that you can do that is by maintaining a healthy weight. We're going to touch on that a little bit more in detail. But we actually offer this weight loss program. It's doctor supervised. We've been doing it for a little over a year now, and we've helped 16 or 17 patients lose 20 to 35 pounds in 6 weeks in a healthy way without injections or GLP-1s. And, we can set up some time to talk about that if you have any interest in the Carathon doctor supervised weight loss program. I went through it myself with my wife. We both went through it together before we decided we'd share it with patients. So there are supplements that you can take to help reduce inflammation as well. So Juice Plus is something I've used myself with my family. I recommend it to all my patients because they've done research showing that it reduces inflammation in the body. So if you're a patient in my office and you've seen my office, you've seen the colorful bottles all over the place. So Juice Plus is a great way to get whole food nutrition and support that anti-inflammatory effort. Again, backed by some clinical research with double-blind placebo-controlled studies. So anti-inflammatory herbs are others. This is, again, not an all-inclusive list, but turmeric, most of us have heard of that, or curcumin, that's another name for turmeric's active ingredient. Boswellia, also is known as frankincense. That's also a great anti-inflammatory. And then rosemary from that plant, that extract, is also an anti-inflammatory. Ginger root as well. So, oh, look at that. Water made it on step number 4 too. Keep that water going. All right, so here's a brief overview of the Karathin. This is one of the things that, again, we offer here, real food, behavior modifications. There's no like shakes or bars or processed foods or things that you have to buy in addition and use with it. You just go to the grocery store, you pick your recipes, you cook the food, you eat the food. It's great training and behavior modification for choosing, good options for food to consume. It's doctor supervised that helps with accountability as well. Again, most people lose 20 to 35 pounds in 6 weeks. And you don't have the yo-yo situation going on with the keratin because of some of the behavior modification and the accountability that comes with it. It helps support the training. And again, it's an anti-inflammatory diet that's used. It's a low-calorie anti-inflammatory diet that's used as part of the protocol. But weight loss in general, you don't have to go use Keratin. That's just something that I'm sharing because that's something that we've found great success with our patients. But the reason that people hold on to weight can vary. It's not a simple equation of calories in, calories out. Calories consumed, calories burned. That equation doesn't always balance because it's the food choices that we have can affect our metabolism. Our genetics can affect our metabolism and how we break down food. The hormones that our body is trying to balance and trying to establish a normal through different stages of life, dealing with stress of varying degrees, that all has an impact on how our body processes food and decides whether or not it needs to store something as far as for long-term use later for starvation mode or for the type of stressful event. And then activity level. So if we're not moving our body much and we're not maintaining regular activity, that can also slow down our metabolism and impact that. So maintain a healthy weight. Another way to help support your gut health. And then we talked about Juice Plus briefly. This is what I recommend for whole food supplements. Here you can see there's 30 different fruits, vegetables, and berries that are integrated into these three products. Most of us are not getting the 7 to 13 servings per day that are recommended for consuming these nutrients and getting these plant nutrients in our body. Most of us might get 2 to 3, maybe 5 at most in a week. So this is a great way to kind of bridge the gap and get some more of those nutrients into your system, which again are anti-inflammatory in their nature. So this is something for another day, but this also has an anti-inflammatory effect, having a good balance of omega essential fatty acids. So this has a good distribution of plant-sourced omega-3, 5, 6, 7, and 9. So those are different types of essential fatty acids that are used by our cells and in different ways. So this is another supplement that's often taken with these other three here. So this gives you just a little overview of why Juice Plus is unique. It's not a multivitamin, it's food. You look at the label, it's got a nutrition facts label on it. It's non-GMO, it's vegan, gluten-free, dairy-free, and kosher. It's certified by the NSF, National Science Foundation, which is a third party that will take a sample basically of each batch that's made of, let's say, the berry blend, and they'll test it for anything that doesn't belong in it, artificial ingredients. It could be toxins, herbicides, pesticides, fungicides, chemicals, heavy metals. Like it'll check for all of, I think it's over 200 different contaminants. It'll evaluate for and make sure that that's not in there. And many pro athletes use products only supported by the NSF or checked by NSF. They're basically verifying what's in the bottle is actually what you're portraying on the label so that the two match. What you say is in the bottle is actually in the bottle. So they'll also verify that with their stamp of approval. And then research, I did mention that briefly. They do have over 48 published clinical studies since 1993. There's more research being done now, so this number is actually higher. But they've done they've done over 48 clinical studies, studying different systems of the body, including gut health. And so looking at their source, they source from family farmers. They have their own private sources with family farmers. They harvest at peak ripeness to get the most nutrient-dense fruits and vegetables possible. Most of our fruits and vegetables are shipped, for days, if not weeks, stored in different environments. When they're harvested well before there's any ripening going on. They often ripen in a box or in a dark room or maybe with some chemicals. So they harvest their fruits and vegetables at peak ripeness to make for the most nutrient dense supplement. And then they quick freeze it, pulverize it, dry it up at a low temperature to remove the water and turn it into these capsules. Here you can see capsules and chewables. And they even have another newer product that takes all six of these capsules, puts them into a stick that you can then dump in water all at once, shake it up, and then drink it. So that's called the Juice Plus Superfoods. So that's another way that you can take these nutrients in. And finally, the probiotics. Taking probiotics, most of us have heard of that. Probiotics are actually bacteria that are consumed, whereas prebiotics are food for bacteria. They're soluble fibers that feed the bacteria. So when you look at this is another combination that you can get from Juice Plus. We have this at home. We're taking this. This is a probiotic with 20 billion CFUs of probiotics in it, as well as this is a tear-off stick you dump in water and can mix up, and that provides 6 different types of prebiotic fibers in it which acts as food for the bacteria. So, if you have ever taken antibiotics, it's like throwing an A-bomb in your gut. It's gonna wipe out the flora. So that trillions of bacteria that you've got in your gut that are helping support your digestion and your function and production of vitamins like vitamin B5, biotin, and vitamin K, those are going to be thrown off by taking antibiotics. So imagine if you're taking multiple series of antibiotics trying to wipe out this sinus infection. So consider repopulating the gut. Do it slowly. There are foods that can be eaten as well that are rich in prebiotics as well as probiotics. But look at that, water comes back again. So so the probiotics I think are really important to implement, and to do that, sometimes that can be done slowly if you have gut issues or a history of gut issues. You might want to do that slowly to get started, depending on your situation. So consult with your doctor if you've got one that's helping you work with your gut. All right. Now I want everybody to contribute here. So wake up, everybody, get back up here. So these are the 7 steps that I suggested, 7 different ways to improve gut health. If any of them stood out to you, I want you, or maybe 2, maybe there's a couple of them. I want you to, in the comments section over on the sidebar or wherever it is on your phone, I want you to make a comment and put in your number there, whichever one it is. I'm going to commit to drinking more water. I'm going to stay active, so I'm going to put 1 and 3. So if you don't set some type of goal coming out of this, you're not going to be able to achieve that or see changes. So like Zig Ziglar said, you can't hit a target you don't see, and you can't see a target you don't have. So this is my call to action for you guys to see if you want information about like Juice Plus,
What did I do?
products, or weight loss program, the Carathon. We've got some information on the next slide. You can take a screenshot of that, and then feel free to reach out. Now the chat, I've got 2 responses. I won't call you out in front of everybody, but I just want to see if.
Where do you put it?
So there should be a little message like tab for chat. It might say chat somewhere on your phone. If you tap the screen, there's a place to
there it is.
chat, and you can put in your number there.
10. Number.
All right, good. Oh yeah. Oh, nice, Jackie. We got 3 going on there. 3 different commitments. Nice.
1, 3.
7
Hmm,
probiotics. Nice. Water. Everybody should have. This was also a test to make
I
sure
lost
everybody
it.
put the number 1 there. No, I'm just kidding. The big take home. Remember that big? That's I put that as number 1 for a reason. Remember, pee in the clear. That's the best way to check it, or half your weight in ounces. Very good. Very good. So make a commitment to some change, pick a target. Now that you've got a target, you can aim for it and you can move towards it. So just remember that your health is everything. It's one of the most valuable things that you have right now. So if you don't make it a priority now, you'll be forced to later. And sometimes it's harder, scarier, maybe too late in some situations to make changes. So consider that. Take care of your health. Be proactive. As chiropractic, that's my forte. Nutritional support with Juice Plus, we can certainly help you with that. And then also weight loss, like I said, feel free to text us, call us, email us.
I have
So,
a I have a question.
oh yeah, yeah. Go ahead.
I don't have a gallbladder because they took it out. So
Yes. So you do have, so
so
even
what's
with the
happened?
gallbladder being removed, you
What's
still
that?
have the duct that goes from your
Right,
liver to your small intestine. So
right.
your liver directly sends the bile down into the small intestine. It's just not as efficient of a system right now. So some of your digestion may be reduced, especially of fats. Remember, the bile is what supports fat digestion and breakdown of fats into smaller and smaller lipids. So there are digestive enzymes that you can take to help support that process. Most digestive enzymes are like a combination of uh, protein digestive enzymes, fat digestive enzymes, as well as um, the carbohydrate digestive enzymes. So but you can also get bile salts. Actually, that's another supplement that you could purchase where it's bovine sourced. So if you're going to eat a fat, heavier fat, meal, then you could take those bile salts with that meal to help support better digestion and processing of that fat.
Interesting. Okay.
Yeah, you can buy they're bovine sourced typically from cows, and they'll take the bile of a cow essentially, make sure that it's clean, and then they'll use those salts in a tablet form. You can just swallow that with your meal, and that'll help support that process. So, but good, very good question. So you still have the bile coming through, but it's just not as efficient now because you don't have a place to concentrate it and to store it so that it can really be dumped into the small intestine, duodenum there.
Okay.
Yeah. Yeah. So anyways, let me just read the slide. And then any other questions? So this is a quote from Paul. Yeah, he said, so whether you eat or drink or whatever you do, do it all for the glory of God. So this is, I think, very applicable to what we're talking about here. Um, that we take care of our bodies. Like I said, be proactive, take care of our bodies, take it seriously, and whatever you eat or drink, don't just do it flippantly, but consider everything that you do for the glory of God to glorify Him and His name.
Amen.
So there's some contact information for me. I'd like to thank you guys for coming out tonight. You can scan that QR code to get more information about the Juice Plus. And then, of course, reach out if you have additional questions. That'll take you right to the Juice Plus website where you could read up on the research, explore some of the products that we talked about tonight, or potentially, drop an order or place an order to try it and see how your body responds. Any
Okay.
other questions?
The probiotic from Juice Plus, how does that is that a tablet or it looks
Yes. Yes, yes. So there's a tablet. It's a capsule actually. So you take
okay.
the capsule, and then this is another support to the gut kind of feed the bacteria. The prebiotic that is a powder that you tear the stick off, dump it in water, and then mix that up good. So this is just the typical dose is there's 30, I think there's 30 or 60. Can't remember now off the top of my head. I think it's 30 capsules to a bottle, but it's one capsule a day is the typical dose that we'd recommend with that. But you can find that on this, follow this QR code or the one here at the end. You can
Okay,
follow that to get some more information.
thank you.
Yeah.
Is it a bitter drink? It's not sweet like you would
Actually,
buy.
I like it. I usually have it at night. Typically, I take the probiotic in the morning, and then the prebiotic I usually have in the evening. But it tastes kind of like iced tea. I think it's almost like a lemonade, like iced tea flavor. It's kind of interesting. It has a little
Mhm.
bit of a sweetish kind of taste to it, but it's not like there's no sugar added to it or anything like that, but it's just because of the soluble fibers that are in it, it has a little bit of a sweeter taste to it. They might use stevia in it, but I can't remember off the
Is
top
that
of my
the
head.
same as you had a sample in your office recently?
That
A
was the
sample?
Juice Plus Superfoods.
So that wasn't the same thing.
Correct. Yeah, that's
Ah,
different. Yeah, so
okay.
there is stevia extract in it to help sweeten some of the soluble fibers. But again, I think that one, that prebiotic, that superbiome, this one here, that tastes like kind of like iced tea to me.
Okay. I like iced tea.
Yeah.
That was
Great.
very interesting. Thank you.
Yeah, you're welcome. You're
Mhm,
welcome.
mhm.
Yeah, did you guys have any other questions? See, I'll try to keep everybody informed, and I'll get that password corrected for next time. But we can shoot for our next gut health talk will be later, actually later this month, beginning of next month. So we'll
Okay.
send out information. We have that available for you.
Sounds
Thank you
good.
so much.
Great.
Thanks.
Knowledge is power. Thank you.
Yeah. All right. Well, you guys go sip a little water, not too much.
Okay.
Before bed. Don't want anybody to be cutting back on their sleep because that's important too. But go ahead
Right.
and sip a little water before bed and chug some first thing in the morning.
Right. Thank you
Thank
so
you.
Thank,
much.
All
All right.
right.
Very
thank you. This
Good
is
interesting.
night,
really,
guys.
really interesting. Thank you very much.
You're very
Thank you.
welcome. Jenna,
I
take care.
agree.
Have a
Yes.
have a good day. Bye, Linda.
All righty. Bye-bye.
See
Have
ya.
a good
Bye.
one. All right.
Bye.
Bye-bye. Signing off.
Thanks for coming.
Okay. Enjoyed it. I'm glad I came.
There we go.